So I'd like to acknowledge the traditional custodians of the land and pay my respects to elders past, present and emerging, and to any Aboriginal peoples present here today. So I want to give you clarity around what you're doing here. This is not a workshop on the PIP-QI. This is a workshop on enabling you to build your skill set to apply for and get that money. So what we are going to do is give an overview and context, so I'll give that, about where we're at currently, what the Commonwealth is saying currently, what resources you have available to you, and I'll do that in 30 minutes at the start. Then I'm going to hand over to the Improvement Foundation, who have come from Adelaide to facilitate this workshop. What they are going to be covering is the model for improvement, so they'll go through that in a second, and change management. So essentially, how you use your information within your practice to fulfil the requirements of the PIP-QI to enable you to get that money. Essentially, the focus and the context for this workshop is teaching you how to do that piece. Okay? I would really encourage all of you at every opportunity to ask your questions and use this opportunity to answer any questions you might have. The Improvement Foundation are experts in their field. So please use them, pepper me with questions, and if you have questions about PenCS, then please do ask them in that session. Can I just get an indication, who regards themselves as a bit of an expert with PenCS? Beginner or intermediate? Either? Is there anyone who's happy to tell me whether they don't have PenCS? That's fine if you don't. Okay, that's fine. All right, no problem. So there's obviously other tools out there instead of PenCS, but the benefit of PenCS is you get it for free if you choose to be in a partnership with the PHN. Okay, so that's kind of where we're heading. So I'm going to start off and give just an overview and context, and I'm going to cover these things. So the definition of quality improvement, the 5th edition standards and what the college says around accreditation for quality improvement in your practice. What the PIP-QI requires from you from a Commonwealth perspective. That's a really great reminder. If you could pop your phones on silent. If you need to take a call, that's absolutely fine. Please do take a call. You'll need your phones on though for Slido. So just pop them on silent, that would be great. So we're going to cover off what the Commonwealth require of you from for the PIP-QI and how to get that money. We're going to talk about privacy and confidentiality because obviously that's an imperative for all of you in terms of your patient data. And then we're going to go through support and resources that are available to you and how to use them in 30 minutes. So if you have questions, that's okay. Do interrupt me and ask questions. Okay, so the college defines continuous quality improvement as an ongoing activity to monitor, evaluate and improve the quality of healthcare delivery to your patients. That is the crux of it. I'd just like to point out that continuous quality improvement is very different from a quality improvement activity. So what continuous quality improvement means is that you've done some kind of activity, like a data cleansing activity for your diabetes patients, for instance, in your practice, and you've discovered that some of them don't have a diabetes management plan. So your next activity building on that data cleansing activity will be, right, let's set up a recall and reminder for those patients that don't have a management plan. Your next activity on top of that will be something else related to that. Do you see what I'm saying? So continuous quality improvement is activity that builds and improves outcomes for your patients. It is not a standalone activity. So it can cover off any of those things. So team-based approaches, peer review, reflective practice, best practice, and of course data is underpinning everything with quality improvement. So you must have clean data and you must be able to demonstrate change through an evidence base, through your data. So the whole point is to, looking for the clicker, there it is, improve your patient outcomes and also get best practice system performance. So why is it important? So many of you will have heard of the quadruple aim. So this came from the Institute for Healthcare Improvement in the US, and they originally came out with the triple aim, which included, that's really hard to see, improved patient experience is what that says, better outcomes and lower costs. The triple aim was where it all started. Then they realised after implementing that for a little while that they can't achieve those things without an improved clinician experience. So you need all four components to get gold standard care for your patients. So a lot of organisations throughout the world use the quadruple aim as their foundation and work towards improving clinician experience, improving patient experience, better outcomes and lower costs. So that's the gold standard, that's what we're all aiming for. Many of you will have heard of PROMs and PREMs, which is patient-reported outcome measures and patient-reported experience measures. Those have basically come out of here to ensure that we're getting the best outcomes for patients. Did any of you go to the Bodenheimer's building blocks workshop we ran in February? Okay, yeah. Bodenheimer is a gent in the US, I think. Is he in the US? Anyway, he's a guy who wrote a research paper around how to achieve the best possible outcomes in primary care. So this is across the whole suite, not just general practice. And what are the elements that you need to fulfill to get to that point? So essentially this was written in 2014 and it's gone off like a shot. Everyone's adopting this approach. The four bottom blocks here are foundational and you need these four bottom blocks to achieve everything else in this diagram. What they say is engage leadership. You can't achieve change or best practice care without sponsorship from the top. You need data-driven improvement, which we will talk a lot about today. You need empanelment, and that just means patient registration. And you need team-based care. So you need to have a multidisciplinary approach to your patients. It can't just be top-down or even middle-down. It has to be all of the people in the team working towards the same outcome. That will then provide the foundation for the rest of these things to happen, which is patient-team partnership, population management, continuity of care, prompt access to care, and comprehensiveness and care coordination. So this all culminates in this rather ambiguous and vague statement which says template of the future. That basically means that you are achieving the best possible outcomes for your patients. Your patients can access the care through lots of different channels. They don't necessarily have to come to reception to log in. They can go through lots of different channels to access care, both in a general practice and in the community. It means that everybody in the organisation is working to top of scope, and it also means that your costs are decreasing. So that's what the template of the future means, and all of these 9 blocks underneath it will help to achieve that end. Any questions? That's just the theory behind it all. Okay, so we're going to go on to the college, then the Commonwealth, then resources. Oh, privacy and data, then resources. Okay, so 5th edition standards. I've pulled out a couple of the criteria that relate to accreditation that are relevant to the QI PIP. I keep changing between QI PIP and PIP QI. The Commonwealth have actually changed their terminology when they changed the release date. That's a funny quirk that they have. They tend to do things like that. So it's actually PIP QI. So the first one, quality improvement activities. The recommendations that they make in the accreditation standards are that you have a dedicated team member responsible for QI. That basically means that you should have someone who's allocated as the touch point in your practice. We will talk a lot today about the fact that quality improvement is a team-based activity and it needs to be driven from the top. So we don't pretend to say that only one person should be doing quality improvement. That actually is too much pressure for that one person, and you do need to have everybody on board. Someone does need to drive it, you do need a leader, but you need that sponsorship from the top. You need to maintain a system to identify and record quality improvement activities, so within your practice you need to have that there, and develop a record of feedback from the practice team, so that's the internal staff, about how that quality improvement is going. So the second one there is patient feedback. So collecting feedback, we talked a bit about this with PROMs and PREMs. Patient feedback is really important, basically as part of the accreditation process, but also in terms of how you choose your quality improvement activity. So you might do a data analysis and you might discover that one particular area might need some work, but then the feedback from your patients says that they would prefer work in a different area. Which one do you think is more important? When you're dealing with people and patient populations, I would go with the second one. But yeah, you need to have feedback and use it to inform your activity. The third criterion that I've pulled out is improving clinical care. Now this is really important, and we will talk about this quite a lot today with our talk around data. So you really do need to use nationally consistent language when you're coding, and we need to move away from writing notes in patient records, because that data cannot be used and it cannot be compared. This is about population health, and I didn't bring my slides up here, but the point I need to make here is this whole incentive, the PIP QI and all of the requirements that go with it, it's not about assessing your general practice on its performance. It's not about assessing any individual general practitioner on their performance. This is about population health and making sure that we are putting our money in the right spot or the right places. So also, if you're using your coding appropriately, that will assist you in figuring out your quality improvement cycles and where to place your activity as well. And then the last one that I've pulled out is health summaries. So the reason I've pulled this particular one out is that these three things down the bottom here, alcohol, smoking and immunisation, are directly related to the 10 measures that the department have released for quality improvement. There are other quality improvement criterion within the accreditation standards. The reason I've pulled these ones out is they relate directly to the PIP. Okay, so moving from the college onto the Commonwealth. So the PIP QI was finally released and went live last Thursday. That means that you are able now to register through PRODA and HPOS and apply for that payment. It crashed, as we all knew it would, on Thursday. So yeah, it's probably good. If you haven't registered for it, you're probably very wise, but you should be able to do that now. So the PIP payments that are ceasing are those 4 listed there, and the PIP payments that are continuing are those 7 plus the PIP QI in addition. You should be quite familiar with all of this. So from a Commonwealth perspective, the PIP payment is all about general practice completing continuous quality improvement activities with the aim to improve patient care and outcomes. So what you commit to is that you commit to implementing those activities in your practice, and you also commit to submitting nationally consistent de-identified general practice data. And it says against 10 key improvement measures that contribute to local, regional and national health outcomes. So that's again down to population health, so that we can make sure that we're putting funding where it needs to go. Now, in terms of those commitments, I'll talk a little bit more about that in a little bit. You will be very familiar with these 10 measures. Now, whilst the Commonwealth state that you need to submit data against those 10 measures, if you have a data agreement with the PHN and you are doing the monthly upload through PenCS or through CAT4, which is the tool that you use in your practice, to the PHN, you are already fulfilling these 10 measures. So you actually don't have very much more of a requirement in terms of reporting against the 10 measures if you already have that in place. For those of you who don't have that in place, or you're using a different system, or you have your own PenCS license that isn't provided to you by the PHN, you are responsible, hear me very carefully, you are responsible for doing that data analysis and that upload yourself to be eligible for the PIP payment. That decision came down on Thursday last week, really recently. So that's actually, there's a lot in that. So if you don't have a secure server, if you don't have a secure way of uploading information, you are responsible for ensuring those things are in place. So it's a bit of a it's a risk that you need to consider as an organisation. So in terms of PIP-QI, PRODA and HPOS, if you don't know how to do this, and I didn't mention this earlier, we have a wonderful team of primary care improvement officers that service the Central Coast region. I think there are 4 of them, Karen? Yeah, plus a team leader. And they are very knowledgeable, and they also have access to a much larger pool of primary care improvement officers. So if they can't answer your question immediately on any of this kind of stuff, they've got a huge number of people they can go and ask. So please do use that resource. They're wonderful, they're really helpful, and they're there to help you. Someone else said to me, what other organisation have access to essentially another staff member without having to pay for their salary? And I'm not saying that's what PCIOs are, but they certainly provide external support to you at no cost to your organisation. We also have Mel Wilkinson here, and I will mention the education team. They've basically done all of the logistics set up for this event, so thank you to Mel and Alison and the team. So if you're having trouble with PRODA and HPOS, please do contact your PCIO and they'll be able to help you out with this. Now, this part is the most important part of this slide. If you've registered for the PIP-QI, you have to, it's your responsibility to provide us with your PIP practice identification number. Now, the reason why you need to do that is that from our end, our requirement to facilitate your payment from the Commonwealth is that we need to provide them with 4 pieces of information. The first is your practice name. The second is your practice location, so your address details. The third is this PIP practice identification number, and we don't already have that. That is a number that you have in partnership with the Commonwealth. We don't have that. We've never had to have that before. We now have to have it. So you need to provide that to us. The 4th piece of information that we provide to the Commonwealth is the date that you submit your de-identified aggregated data to us. That is all. So for the first quarter, that is all we provide to the Commonwealth to facilitate your payment. No data goes further than the PHN, and it's de-identified and aggregated. So I'll come to that a little bit more in a second. So there are 2 components that you need to do to meet your requirements to be eligible for the PIP. Okay, so you need to participate. Now, one of the biggest things here is the word in partnership, and I've left my piece of paper over here, so you'll have to bear with me whilst I walk over and get it. Basically, this has caused some confusion and consternation amongst general practice around what partnership means and how much is required from general practice in terms of fulfilling that requirement, because it is an eligibility requirement for the PIP payment. So I'm going to read you exactly what the department says on this, if I can find the page. All right, here we are. So, in the department's initial conversations with PHNs, many PHNs were providing at least 3 levels of tiered support in the quality improvement space. The department wanted to build on that without excluding any current interaction with PHNs. So the phrase in partnership with your local PHN is a broad term, which includes, it accommodates the variety of ways PHNs are currently tailoring their service offering to general practice. It recognises that not all practices need or want face-to-face PHN support, which is fine. And it recognises that not all PHNs have the capacity to provide face-to-face support. So bear in mind, there are only 4 PCIOs, so their resources are limited. So they may not have the capacity. If you have a conversation with a PCIO, that is defined as in partnership, about your quality improvement activity. If you download one of the toolkits from our website or the quality improvement guide and tools from our website, that is in partnership. Okay, so that component there is reasonably easy for you to fulfil, and you don't need to engage heavily with the PHN to fulfil it. It's up to you and where your organisation is at. There are no set targets for the quality improvement measures. This is another really important point from your perspective. For the first quarter, and for however long, we don't know yet, you don't have to provide any evidence of, I'm a bit scared to say it, but you don't have to provide any evidence of improvement. You have to complete continuous quality improvement activities, but there doesn't need to be any kind of growth, which is amazing. Basically, there are no targets. If you start out with a baseline measure and you do your dump and then you do your quality improvement activity, in 2 months' time you do another measurement of your data, and that demonstrates maybe a 2% increase, then you've fulfilled the requirement of the quality improvement PIP. Now, I'd just like to point out, we have been given this much information. I have no doubt that there is this much information from a Commonwealth perspective, and we can all see down the tunnel and see where it's headed. But this is where it's at the moment, so I would recommend that all of you take advantage of this. So no set targets. You can also choose, if you've been doing quality improvement already in your practice and you're quite experienced, and your quality improvement activity doesn't fit into those 10 measures, you're still eligible, as long as you can demonstrate that you're doing it. You're still eligible for the PIP payment. The second component that you need to do in terms of being eligible for the PIP payment, you obviously need to be accredited, but you need to provide your eligible data set to the local PHN. As I mentioned before, the monthly upload covers off this requirement. We have fabulous data analysts in our PHN, which some don't, so we are very fortunate to have that, who have the skills to pull that information from the monthly upload that you already submit. So that is a requirement. You have to report against those 10 improvement measures, but in terms of the quality improvement activity, you can do that in another area. Is that clear? 1 per quarter, 1 activity per quarter. So you don't have to do 5 quality improvement cycles, you need to do 1, on the premise that there is an understanding that you will build on it. Okay? Does my practice have to share data with the PHN? Yes. That is the Commonwealth providing some stick. That is the only way around it. You have to have a relationship with us, and you have to share that data with us. There is an exception, obviously. So the Aboriginal Community Controlled Health Organisations, you do not have to have any kind of partnership or relationship with PHN. You just follow your current processes against the national KPIs and submit straight to the Commonwealth. If these guys want to use the services of the PHN, then they are more than welcome, but they don't have to actually have a partnership with us. So I've just written out some benefits here, of benefits of sharing with us. You do get a license for the Cat4 software suite at no cost. We provide you back with dashboard reports. So we don't just have that data sitting there. We analyse it with our data analysts, and we provide you back with a quarterly report, which will help you identify areas of interest in terms of quality improvement activity, if you choose to use it that way. So that's how that works. You do get the personalised support from the primary care improvement officers and support with quality improvement activities if you want it. I would strongly suggest, if you don't know who your primary care improvement officer is, to talk with Karen down the back today, and we'll sort that out for you. So this is the privacy and confidentiality bit where I was talking about the data and where it goes and what happens with it. So currently, if you have a data agreement with the PHN, your practice does a monthly upload in the background behind the PenCS tool, behind the PenCat, sorry, it's not PenCat, I keep calling it PenCat, it's not PenCat, it's the Cat4 tool in your practice. So it does a monthly upload to the PHN via 2 secure servers, okay? It is de-identified and aggregated. If it is not de-identified or something happens at the practice point, that data is removed from your data set before it is uploaded. So there is a function within PenCat, within PenCS, that will not allow that data to go any further. So we never see patient names or any kind of detail like that. And Matthias will go into that more thoroughly in his session. What we are moving to, as at the 1st of August, if you apply for the PIP QI, is that we will have our current state So we'll have you'll upload your de-identified data monthly. It comes to the PHN and stops. We provide that information back to you in dashboard quarterly, so you can inform your activities. What will then happen is that we send those 4 things to the department. So your practice name, practice location, PIP identifying number, and the date that you submitted the data. That's all. So that's where we're moving to. Questions?
Department of Health doesn't get that you've improved this, that, or the other.
No.
It stops with you.
It stops. Yeah. So we need to have an understanding of what you're doing in terms of quality improvement, and you advise us of that through your PCIO, but no other information goes any further yet. Any other questions?
What do you do with the data?
We do that analysis of it and provide it back to you with the dashboard report. So the PCIOs use that dashboard report to help you consider your patient population and figure out where there are areas that you could perhaps focus on.
Is it not used elsewhere for anything else? Or
We also use it for our needs analysis. So it's de-identified and aggregated. So obviously, you know, we have to, our requirements to the department, we have to have a needs analysis for our region. So we do use that for our needs analysis as well, to figure out where our areas of importance are.
Yeah. There was a, just a little bit on my part, there was a recent instance where ACCC launched urging against Health Engine, and they were using data to provide to pharmaceutical companies and all this stuff. So that's a little bit of a worry when embarking on this.
Yeah.
What's the patient stance on that, and you know, where is the grade of the data?
So,
although it's de-identified and aggregated.
I wish our IMIT manager was here, but we have very secure systems, and we have to have extremely secure systems because we're dealing with a lot of information like this. The risk in that kind of situation, where data might be provided externally to other organisations, is with you. So if you choose to provide that information to us via a different method, you are responsible for putting in place those safeguards and those secure servers. If you don't do that well, then that's often where the leaks occur. But in terms of our processes, they are very secure.
Okay.
Yeah.
And the grade is with PHN at this stage for the first quarter?
Beg your pardon?
So the grade so the end point for the data
Is us.
with PHN?
At the moment, that's where it stops. Yeah. Yeah. Any other questions? Because this is really important. Yes?
If there's a quality improvement that a practice is doing really well, is that information going to be forwarded to other practices so they can possibly follow that routine?
That's a great question. So that was, if a practice is doing really well and a quality improvement activity is really successful, can that information be shared? So I'll come to that in the resources section, but we are setting up a community of practice through our SharePoint site, which again has lots of firewalls, which you will be able to do that peer-to-peer conversation and sharing. So yes. Okay. All right, so this is the resources available. So RACGP has some really great resources that you can use for quality improvement. So they have their guidelines for preventative activities in general practice, and that's their red book. You will be provided with these slides, and you can just click on the link and it will take you to the relevant spot. Then you've also got the actionable plans, which is the green book. So that's putting prevention into practice. So that actually tells you how to do some activities in that space. And then we've got the National Guide to Preventative Health Assessments for Aboriginal and Torres Strait Islander people as well. So all these resources are really fantastic for quality improvement. And they've also got other things on their website. So if you're searching around for something to do, you're kind of clear on what you want to focus on as an organisation. You can go around and have a look whether there's anything there that could support you in that. Use your PCIO as well, they're very knowledgeable about this stuff. In terms of the Commonwealth, I would like to recommend that you allocate one person in your practice to check the Commonwealth website every single week, because they are releasing things in a dribby and drabby way and we don't even know when they're going to be doing that and what they're going to be uploading. Currently they have the PIP QI guidelines, and the PIP eligible data set data governance framework. If you haven't read those 2 documents, I would encourage you to have a read. You'd all be familiar with the improvement measures. They have a document up there that goes into a little bit more detail about each of those measures. They have a PIP QI FAQs. I'm also going to provide you with another FAQ document that WAPA, which is the Western Australian PHM, put together, which has the swappy rates in it and demonstrates, if you're doing 4,000 swappies per quarter, how much, I think it's 20 grand. That's how much it will bring to you. So it's $5 per swappy for the PIP QI, and then to a maximum of 12.5 grand per quarter to a maximum of 50 grand per year. Okay. There is also a table in that document that demonstrates different IT systems and how they interact. So that will be provided with the slides after this session as well. NCS have a whole lot of resources and support available to you. Their website is amazing. They do have a lot of webinars. So if you're a beginner or an intermediate user, you can just go to their website and basically ask for the question that you want answered, and they're bound to have some kind of resource on it. So they have a whole lot of things that they call recipes, which basically take you through step by step through the system as to how to do something, which is really handy. And they released Monday last week recipes specifically for the PIP QI measures. So if you're looking at data cleansing, it's a great place to start and a really easy place to start. Matthias this afternoon will go into that more. And then in terms of the PENS PHN support options, we have a quality improvement page on our website. On that, there is a quality improvement guide and tools. That document basically outlines in brief what the Improvement Foundation will be teaching you today. So it's a good resource, it's all in one place. In your packs or on your USB, you also have something called a GP readiness checklist. That is for you to use in your practice to see where you're at in terms of quality improvement and what you could perhaps do to be ready to start. You don't need to submit that to anyone, it's just for your information, just a resource for you to use. We are also releasing some quality improvement toolkits. We only have 2 up on the website at the moment, that's cancer screening and mental health and suicide prevention, but we're having, what these toolkits are is basically a little bit of background around that specific clinical area, then an example, a checklist for you, and then a couple of examples for PDSA cycles that you could do. So plan, do, study, act cycles, which is part of the model for improvement. We're going to release toolkits on practice management, digital health, 45 to 49 years health assessment, 75 plus health assessment, medication management, recalls and reminders, sexual health screening, smoking cessation, nurse-led clinics, Aboriginal health, healthy weight, immunisation, CBD and diabetes management. So they're all going to be up there eventually. It's been quite a big job. So we're getting there, but we only have 2 up at the moment with another 3 or so in the works. But hopefully in the next month, all of those will be up. And as I just mentioned, we're also doing some 1-pagers around weight, ethnicity, alcohol consumption. So all of those things are part of accreditation, but in terms of qualifying for the PIP QI, you need to actually run quality improvement activities in them. So we're going to provide you with some information around that. You've got PCIO support available to you, and as I just mentioned before, we've got the community of practice in the works as well, hopefully released in the next month, which will provide you with a platform to have conversations with your peers. If you're comfortable, upload PDSA cycles that have worked for you with some ideas around that, and perhaps consider discussing your quality improvement plans, which Colin and Mel are going to talk about in the next session. So that's it for me. Are there any questions that occur to you? We are going to move on now to the workshop. So this was an overview to cover off the PIP QI and how that impacts you guys and what the requirements are. So now we're looking to build your capacity and your capability in running those activities and make it as easy for you as we can. So that's the purpose of what we're doing now. But please do ask any questions of me if you have any.
Yeah. Is there a reason to go with NCS as opposed to other providers?
Look, historically we have the question was, is there a reason to go with PenCS? So there are other tools out there. Polar is another big company that some organisations use. There's also about, oh gosh, there's a list of about 8 other really small ones. The Commonwealth for the PIP-QI are preferring PenCS and Polar in terms of that payment, and have made it quite easy to facilitate the payment through those 2 providers. Having said that, they are also putting in place a exemption strategy for people who don't use those particular organisations. In terms of PHN and why we use them, we constantly reevaluate and see whether they are still the right company to be using. It is historical for us. We have used them for quite a long time. There are pros and cons, as ever, but we do go through formal tendering processes. Yeah, on that. It's not just a, yes, we'll just use you all the time. Yeah, yes.
Is doing things like the STAR-E and Diabetes Alliance, or like hiring a medical assistant, is that considered quality improvement?
Say that again, sorry.
Doing like STAR-E or the Diabetes Alliance, or like having a medical assistant in your practice, is that considered quality improvement?
Not in and of itself. So those things are a great step in the right direction. So it was Diabetes Alliance and STAR-E and a medical assist. You can definitely use those resources and those connections to fulfil the requirements. But remembering that, you know, the outcome of quality improvement is aimed to improve patient outcomes and patient experience and patient care for your practice population. Yeah, so it's about having that activity around it. Yeah.
Link it, if you can demonstrate with them.
Yeah.
Yeah, 'cause that-
Definitely use them as the foundation. Yeah. Yep. All right, I might hand over to Mel and Colin now. I'd like to welcome them and thank them for being here all the way from Adelaide. And yeah, it's going to be fun. So get involved.